Today we're diving into a really tough story about this young man named Cole Schmidtknecht who died from an asthma attack.
Yeah.
But it wasn't just, any asthma attack. This is a story that really kind of brings up questions about, prescription drug costs and the role of these pharmacy benefit managers, the PBMs.
Right.
So we're going to kind of unpack all of that today with the court documents you've provided, some news articles to uncover what led to this tragedy and what it might mean for you when it comes to, accessing your own health care.
Absolutely. It's a case that really gets at the heart of how complex and often really opaque this whole prescription drug pricing system can be.
So Cole was only 22 years old,
Yeah.
and his parents describe him as, huge Milwaukee Bucks fan,
Right.
avid gamer. They said he was curious, he was knowledgeable, and he was funny.
Yeah. And importantly, Cole was not new to managing his asthma, right? Like he had a routine. He knew what his triggers were. He relied on his medication to keep his condition under control.
Yeah. So he went to go refill his usual prescription. It was for Advair Discus at a Walgreens pharmacy in Appleton, Wisconsin, back in January of 2024.
Right.
And that's where things kind of went sideways.
Yeah. What happened next really set off this chain of events that ultimately led to his death.
Yeah.
So at the pharmacy, he was quoted a price of $539 for this medication,
Wow.
which is pretty shocking considering he normally paid around $66.
Oh my gosh, that's an incredible jump. I can't imagine being in that situation and having that kind of unexpected cost.
It's a significant increase, and it raises questions about, we were just talking about PBMs, their role in these kind of pricing fluctuations.
So his parents are now suing both Walgreens and OptumRx, which is the PBM that manages Cole's, prescription coverage.
Right.
And they allege that Walgreens really didn't do anything to help him.
Right.
They didn't offer any cheaper generic options. They didn't, suggest that he contact his doctor or the insurance company. It was basically like, take it or leave it.
Yeah. Yeah. And to be fair, OptumRx did claim that Cole purchased a different asthma medication that day.
Oh, okay.
But it was later clarified that that was actually for his rescue inhaler,
Yeah.
not the Advair Discus that he was, relying on for daily management of his asthma.
So tragically, Cole left the pharmacy without his medication. He just couldn't afford that inflated price. And he tried to, manage his asthma with just his rescue inhaler.
Right.
But just a few days later, he suffered a fatal asthma attack.
And, it just raises the question of whether his death could have been prevented if he had had access to his regular medication.
It's heartbreaking. So
Yeah.
let's talk a little bit more about these PBMs because it seems like they're behind the scenes, right? Most people
Sure.
probably don't even know what they are, but they have this enormous influence on the price of prescription drugs.
They really do, yeah. PBMs are essentially the middlemen between drug manufacturers, insurance companies, and pharmacies. So they're negotiating drug prices, they're determining what medications are covered by different insurance plans,
Right.
and then they set reimbursement rates for the pharmacies.
They're not really known for being transparent, are they?
That lack of transparency is a major issue.
Yeah.
PBMs use these complex pricing models that are often shrouded in secrecy, so it makes it extremely difficult for patients and even healthcare providers to understand how drug prices are determined.
So how does, this lack of transparency play into a situation like Cole's?
So, for example, PBMs often negotiate rebates from drug manufacturers.
Okay.
And these rebates are supposed to lower the cost of the drugs for the insurers and the patients. But the way that they're structured can actually lead to higher list prices for the drugs.
So they negotiate rebates that actually make the price higher.
That's where things get really complicated.
Yeah.
PBMs argue that those rebates offset the cost of drugs for the insurers. However, critics argue that the PBMs are actually keeping a portion of the rebates for themselves, which is incentivizing them to actually favor drugs with higher list prices and bigger rebates.
So they're profiting from the system that is hurting the patient.
That's the concern. And because of this lack of transparency, it makes it really difficult to assess what the true cost of medications is and how much the PBMs are actually contributing to driving these prices up.
It's like a black box. Nobody can see into it.
Exactly.
So in Cole's case, the lawsuit alleges that OptumRx actually violated Wisconsin law by raising the cost of his medication with a valid medical reason, and they didn't even provide like the 30 days notice of this price increase, which is required.
Right.
So there's legal implications, but also ethical ones as well.
Yeah,
This really highlights the need for some greater transparency and accountability in the way that PBMs operate.
absolutely. The current system is just simply not working for patients.
Yeah.
We need to understand how these practices are impacting individuals like Cole and what can be done to ensure fair and transparent pricing for these medications.
So we talked about rebates. Are there other PBM practices that are kind of obscuring this pricing for patients?
Yeah, there's one called spread pricing. And spread pricing is basically where the PBM charges the payer, like an insurance company, a higher amount for a drug than what they reimburse the pharmacy.
Okay.
So that difference, that spread, becomes profit for the PBM.
So they're making money on both ends.
Right. And this practice, just like the rebates, contributes to that lack of transparency and can lead to higher costs for patients.
And I imagine this is especially problematic for patients who rely on, specialty medications for chronic conditions like cold.
Exactly. Patients who need those types of medications often have fewer options, and they're much more vulnerable to this kind of price manipulation.
This is all really unsettling. It just feels like the system is rigged against patients.
I understand how you feel.
Yeah.
The complexity and opacity of these PBM practices can be really infuriating, especially when you consider the real-world consequences for people like Cole.
So what can be done about this?
Well, there are a number of potential solutions being explored, including legislative reforms that are aimed at increasing that transparency and regulating PBM practices.
Okay, well, let's dive into those potential solutions after we hear a word from our sponsor.
Sounds good. We'll be back to discuss that and some of the broader implications of this issue for your own access to healthcare.
We're back, and before the break, we were talking about the lack of transparency with PBMs and some of their practices.
Right.
It's pretty clear that something needs to change, but what can actually be done?
There is some growing momentum for some legislative reform
Right.
at both the state and federal level that's really aimed at addressing these issues.
Okay.
And one area of focus is on increasing transparency
Okay.
around the PBM pricing practices,
Right.
requiring them to actually disclose more information about how they operate.
That seems like a good first step.
Yeah.
If we can shed some light on how these companies are operating, it'll be easier to identify and address some of the more problematic practices.
Exactly. And another area of focus is regulating the PBM fees and rebates. So some of these proposals aim to limit the amount that PBMs can charge in fees or require them to pass those rebates directly to the consumers.
That makes sense.
Yeah.
If rebates are supposed to lower drug costs for patients,
Right.
it seems logical that they should go to the patients.
Exactly.
Right.
Yeah, I agree. And there's also a push to just ban certain practices altogether,
Okay.
like spread pricing that we talked about earlier, where the PBMs profit from that difference between what they charge the payers and what they reimburse to the pharmacies.
It sounds like lawmakers are starting to recognize that there's a need to rein in some of these PBM practices.
Yeah, they are.
But you mentioned state and federal levels.
Yeah.
Is there a difference in the approaches?
There are some differences. Some states have been more proactive than others in implementing legislation to regulate PBMs.
Okay.
For example, some states have actually passed laws requiring PBMs to be licensed or registered, which increases oversight of their operations.
So it's like a patchwork of regulations across the country.
That's right. And that can actually create some challenges
Yeah.
for both PBMs and patients. And so there is a growing kind of recognition that a more comprehensive federal approach might be needed
Okay.
to create that, level playing field and ensure some consistent patient protections across all state lines.
Federal regulation, though, takes a long time.
It does.
So what can people do right now? It feels overwhelming.
You're right. It is a complex issue with lots of moving parts.
Yeah.
But there are things that you can do to be a more informed and empowered healthcare consumer.
Like what can we do?
First, talk to your doctor and your pharmacist about medication options.
Okay.
Ask about cheaper alternatives, like generics or therapeutic equivalents.
Okay.
They might be able to suggest some strategies to help you manage your medication costs.
That's a good point. A lot of people don't realize that
Right.
there are often alternatives available, and they might be hesitant to ask, but doctors and pharmacists are there to help.
Absolutely. They want to make sure that you can access the medications that you need. So don't be afraid to advocate for yourself and ask questions.
What about negotiating directly with the pharmacy? Is that even possible?
It can be, yeah. Some pharmacies are willing to work with you on pricing, especially if you're a regular customer.
Okay.
They might have discount programs or coupons that are available.
So it's worth asking, even if it feels a little awkward.
Definitely, you never know what options might be available unless you ask.
So talk to your doctor and your pharmacist.
Right.
Check for alternatives, inquire about discounts.
Yeah.
What else?
Look into patient assistance programs.
Okay.
A lot of pharmaceutical companies actually offer programs to help patients afford their medications.
Okay.
Now, these programs might have some eligibility requirements, but they can be a lifesaver for those who qualify.
Where can people find information about these programs?
You can often find information on the pharmaceutical company's website, or you could ask your doctor or pharmacist for some guidance.
Are there any resources online that can help people kind of navigate all of this?
Yeah, there are. There are organizations like Needy Meds
Okay.
and the Patient Access Network Foundation,
Okay.
and they provide information about these patient assistance programs and other resources for affording medications.
So there are organizations that are dedicated to helping people, navigate this process. That's good.
Yes.
So this is your health and it's your money.
Yes.
You have the right to be informed and to advocate for yourself.
Exactly.
So don't be afraid to ask questions, push back when necessary, explore all of your options.
Absolutely.
All right, so let's go back to Cole's story for a second.
Okay.
His parents have filed this lawsuit.
Right.
They clearly are seeking justice for their son. What does that look like to them?
Well, they're hoping to hold Walgreens and OptumRx accountable for their actions
Okay.
and hopefully bring about some meaningful change in the healthcare system to prevent, similar tragedies from happening in the future.
So it's beyond just, compensation.
Mhm.
They're looking to spark a bigger conversation about healthcare reform.
Exactly. They want to raise awareness about the hidden costs of these prescription drugs and the lack of transparency that exists in the system.
Right.
And they're also pushing for legislative changes that would actually protect patients from these unfair pricing practices.
Their lawyer has talked about, corporate accountability and these policy changes. Is there anything specific that they're hoping to see change?
Well, one specific change they're advocating for is requiring pharmacies to actually provide patients with clear and concise information
Okay.
about the cost of their medications before they fill the prescription.
So no more surprises at the checkout counter.
Right. Patients should be able to make informed decisions about their health care without being hit with these unexpected bills.
Seems reasonable. It is. What else are they advocating for?
Greater transparency from PBMs, particularly around their pricing models and the rebates that they receive from the drug manufacturers. They believe that this information should be made public so that patients and policymakers can understand how these drug prices are determined.
It's hard to argue with that. Transparency and accountability seem like pretty crucial steps towards creating a fairer system.
I agree. And it's not just about holding corporations accountable. It's about empowering patients to take a more active role in managing their own health care and advocating for their rights.
So their goal is that no other family has to endure what they have.
Yes, they believe that justice for Cole means justice for all Americans in terms of access to affordable health care and these life-saving medications.
That's a powerful message. And it raises the question of how can we all contribute to this fight for change?
Well, as we discussed, there are those practical steps that you could take to manage your own healthcare costs, but you can also get involved in advocacy efforts at a broader level.
So it's both individual action, but also collective action.
Exactly.
And ultimately systemic change.
Yes, there are a number of organizations out there working to reform the healthcare system and to make these medications more affordable. And you can support these organizations by donating, volunteering, or simply spreading the word about their work.
So raising awareness, getting involved, making our voices heard.
Exactly. The more people who speak out about this issue, the more likely we are to see that meaningful change.
So individual action, collective action, and ultimately systemic change.
That's right.
And, while we've been talking about, Cole and everything that happened, there's something else that I thought was really touching that came out of the research you provided.
Okay.
And it's that while Cole was on life support, his parents discovered that he was actually an organ donor.
Wow. It's a real testament to his character, even in the face of this tragedy.
It really is. And I think it's this reminder that even in the darkest of times, there are these little, glimmers of hope and humanity.
Right. And it's also a powerful example of how one person can make a difference even after they're gone. Organ donation is such a profound act of generosity, and it can save lives.
Yeah. It's something that, a lot of us probably don't think about until we're faced with a situation like this.
Right.
But Cole's story really highlights how important it is to consider organ donation.
Yeah, it's definitely a conversation we should all have with our loved ones.
Cole's parents have said that this discovery brought them a sense of peace and comfort.
I can understand that.
Knowing that parts of him would live on and help others, gave them this glimmer of hope in the midst of just unimaginable loss.
It's a beautiful sentiment, and I think it speaks to the enduring impact of his life and legacy.
And it also kind of connects to this larger point about just the interconnectedness of our healthcare system. We've been focused on the challenges, the access, affordability,
Yeah.
but there are these inspiring stories too about compassion and generosity, like Cole's.
Yeah, it's important to remember that healthcare is ultimately about people taking care of each other.
So as we wrap up this deep dive into, prescription drug costs, it's important to remember that we all have a role to play in shaping a better future for healthcare.
Absolutely.
We can stay informed.
Yes.
We can engage in conversations about these issues.
Right.
We can support efforts to make healthcare more accessible and affordable for everyone.
That's right.
And we can advocate for ourselves and for our loved ones, demand transparency and accountability from those in power,
Right.
and ultimately work together to create a system that prioritizes the well-being of all.
A vision worth striving for.
So on that note, I think we've reached the end of our deep dive.
Okay.
But, the conversation doesn't end here. We encourage you to continue exploring these issues and to take action in your own communities.
Remember, you have a voice, and it matters. Use it.
Until next time, keep diving deep.